Hello. In this podcast, I will give you information about what is cancer, cancer diagnosis, treatments, the latest developments in cancer treatment, and more. You will learn quality things after listening. Let's start. What is cancer? Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells can form tumors or invade nearby tissues and organs, causing damage and impairing normal bodily functions. Cancer can affect any part of the body and can spread to other parts through the bloodstream or lymphatic system. There are many different types of cancer, each with its own unique set of symptoms, risk factors, and treatment options. Some common types of cancer include lung cancer, breast cancer, prostate cancer, and colorectal cancer. Cancer arises from the abnormal growth and division of cells. Normally, cells grow and divide in a controlled way, with new cells being produced only when the body needs them. But sometimes, cells begin to divide uncontrollably, forming a mass of tissue called a tumor. Tumors can be benign, not cancerous, or malignant, cancerous. Benign tumors do not invade nearby tissue or spread to other parts of the body, while malignant tumors can invade nearby tissue and spread to other parts of the body through the bloodstream or lymphatic system. What are the types of cancer? There are many types of cancer, each with its own unique set of characteristics, risk factors, and treatment options. Here are some of the most common types of cancer. Breast cancer. This is a type of cancer that forms in the breast tissue. It is most commonly diagnosed in women but can also occur in men. Lung cancer. This is a type of cancer that starts in the lungs. It is most commonly associated with smoking but can also occur in non-smokers. Prostate cancer. This is a type of cancer that forms in the prostate gland in men. It is one of the most common types of cancer in men. Colorectal cancer. This is a type of cancer that forms in the colon or rectum. It is one of the most common types of cancer in both men and women. Skin cancer. This is a type of cancer that forms in the skin. There are several different types of skin cancer, including basal cell carcinoma, squamous cell carcinoma, and melanoma. Leukemia. This is a type of cancer that affects the blood and bone marrow. It is characterized by the uncontrolled growth of abnormal white blood cells. Lymphoma. This is a type of cancer that affects the lymphatic system. It is characterized by the uncontrolled growth of abnormal lymphocytes. Pancreatic cancer. This is a type of cancer that forms in the pancreas. It is often difficult to diagnose and treat because it may not cause symptoms until it has spread to other parts of the body. Ovarian cancer. This is a type of cancer that forms in the ovaries. It is often difficult to detect in its early stages, which can make it more difficult to treat. Brain cancer. This is a type of cancer that forms in the brain or spinal cord. It can cause a range of symptoms, depending on the location of the tumor. These are just a few examples of the many types of cancer that can occur in the body. Each type of cancer requires a different approach to treatment, so it is important to work with a healthcare provider to develop an individualized treatment plan. What are cancer risk factors? Cancer risk factors are factors that increase a person's likelihood of developing cancer. Some risk factors can be controlled, while others cannot. Here are some of the most common cancer risk factors. Age. The risk of developing cancer increases as a person gets older. Genetics. Certain genetic mutations can increase a person's risk of developing certain types of cancer, such as breast cancer, ovarian cancer, and colorectal cancer. Lifestyle factors. Factors such as smoking, drinking alcohol, poor diet, lack of exercise, and exposure to carcinogens, such as asbestos or ultraviolet radiation, can increase a person's risk of developing cancer. Chronic infections. Certain infections, such as hepatitis B or C, human papillomavirus, HPV, and Helicobacter pylori, H. pylori, can increase a person's risk of developing certain types of cancer. Environmental factors. Exposure to environmental toxins, such as air pollution or radiation, can increase a person's risk of developing cancer. Medical history. Certain medical conditions, such as inflammatory bowel disease, can increase a person's risk of developing cancer. Family history. Having a family history of cancer can increase a person's risk of developing certain types of cancer. It is important to note that having one or more risk factors does not necessarily mean that a person will develop cancer. Many people who have one or more risk factors never develop cancer, while others who do not have any known risk factors may still develop cancer. It is important to work with a healthcare provider to understand your personal risk factors and develop a plan for reducing your risk of cancer. Cancer diagnosis. Cancer can be diagnosed through a variety of tests and procedures. The specific tests used will depend on the type of cancer suspected and the patient's individual circumstances. Here are some of the most common methods used to diagnose cancer. Imaging tests. These tests, such as X-rays, CT scans, MRI scans, and PET scans, use technology to create images of the body that can help detect tumors or other abnormalities. Biopsy. This is a procedure in which a small piece of tissue is removed from the body and examined under a microscope to look for signs of cancer. Blood tests. Certain blood tests can help detect markers that may indicate the presence of cancer, such as elevated levels of certain proteins or tumor cells. Endoscopy. This is a procedure in which a flexible tube with a camera on the end is inserted into the body to examine organs or tissues for signs of cancer. Genetic tests. These tests can help identify genetic mutations that may increase a person's risk of developing certain types of cancer. Once cancer is diagnosed, additional tests may be done to determine the stage of the cancer and the extent to which it has spread. This information can help guide treatment decisions and determine the patient's prognosis. It is important to work closely with a healthcare provider throughout the diagnostic process to ensure that all necessary tests and procedures are performed and that an accurate diagnosis is made. Cancer treatment. Cancer treatment depends on several factors, including the type and stage of cancer, the patient's overall health, and the patient's preferences. Here are some of the most common cancer treatments. Surgery. Surgery is often used to remove tumors and other cancerous tissue from the body. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells and shrink tumors. Chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop them from growing. Immunotherapy. Immunotherapy is a type of treatment that uses the body's own immune system to fight cancer. Targeted therapy. Targeted therapy uses drugs that target specific proteins or other molecules that are involved in the growth and spread of cancer cells. Hormone therapy. Hormone therapy is used to treat cancers that are affected by hormones, such as breast cancer and prostate cancer. Stem cell transplant. A stem cell transplant may be used to replace damaged bone marrow in patients with certain types of blood cancers. Palliative care. Palliative care is a type of care that focuses on improving the quality of life for patients with advanced cancer or other serious illnesses. It is common for patients to receive a combination of treatments, such as surgery followed by chemotherapy or radiation therapy. It is important to work closely with a healthcare provider to develop an individualized treatment plan that takes into account the patient's unique circumstances and preferences. Cancer research. What are the latest developments in cancer research and innovations in treatment? There are many exciting developments and innovations in cancer research and treatment. Here are a few examples. Immunotherapy. Immunotherapy is a type of cancer treatment that harnesses the power of the immune system to fight cancer. This approach has shown promise in treating a variety of cancers, including melanoma, lung cancer, and bladder cancer. Researchers are continuing to explore new ways to use immunotherapy to treat cancer. Precision medicine. Precision medicine is an approach to cancer treatment that takes into account the unique characteristics of each patient's cancer. By analyzing a patient's tumor at the molecular level, doctors can identify specific genetic mutations or other abnormalities that may be targeted with specific drugs. This approach has shown promise in treating certain types of cancer, such as lung cancer and breast cancer. Car-ttherapy. Car-ttherapy is a type of immunotherapy that involves removing immune cells from a patient's body and modifying them to target cancer cells. The modified immune cells are then infused back into the patient's body, where they can attack and destroy cancer cells. Car-ttherapy has shown promise in treating certain types of blood cancers. Liquid biopsies. Liquid biopsies are a type of test that analyzes a patient's blood for signs of cancer. This approach has the potential to be less invasive and more convenient than traditional biopsies, which involve removing tissue from the body. Artificial intelligence (AI) is being used in cancer research and treatment to analyze large amounts of data and identify patterns that may be missed by human researchers. This approach has the potential to improve the accuracy of cancer diagnosis and treatment. These are just a few examples of the exciting developments and innovations in cancer research and treatment. As researchers continue to make progress, we can hope to see even more effective and personalized treatments for cancer in the future. Thank you for listening to me.